She came in because she was not satisfied with the antidepressants that she was on. And taking her history, I realized that literally throughout every SSRI had been prescribed, and she really looked worn down in terms of what she had gone through. We lose some of the subjectivity that's important, I think, in a psychiatric treatment, which is to understand what the patient is trying to convey to us, their struggle with the treatment. And sometimes it's, more cut and dry for us to say, no, take this. And despite the fact that they're trying to tell us that it doesn't work for them, we keep on saying, well, we'll change to this, we'll change the dose, so on and so forth. And ultimately, she was beginning to lose faith. And I said, you know what? It's time. It's time for what I think would be the right thing to do, which is to do this testing on her. And she said, okay, considering where I am in life and how much I've struggled, yes, I like to do this. And I take out the envelope, I open it up for them, and they're looking inquisitively as to what the process are, because when you use the word, genetic testing, it's sort of a big word, like, wow, what does it mean? So I open the tube for them and I say, why don't you hold this tube? And these are the two lines. There's a pouch. You're going to, produce as much saliva as you can and fill up to that line. Don't close it. I will do that for you, and let me do some paperwork in the meantime, the requisition form. You can see an awe, really, for a patient. It's like, this is easy. And I right away shut it off, put it on, they sign the thing, we put everything label, it goes in the package, and I said, this will go out tonight, and we are done. You will get the results in 5 days. And when the test came back, I remember, and I looked at her, I said, first, I apologize that I didn't believe you. You are absolutely right. And she looked at me and said, why do you say that? I said, because your essay shows that you are an extremely poor responder to an SSRI and likely to have severe adverse effects. And that is what you have been trying to convey to so many clinicians all along. And I don't know what's been the reason, but somehow it has fallen through the cracks. So it's time to make a change. Yes, I know your symptoms. I know everything that has gone. I know the list of medicines that you have struggled with, and what has happened. But now I have an explanation for that. And I can propose something, how to modify, change for the better. I think that was a wonderful moment. And the ease, the comfort, not only for the patient, believe me, for me as well, to do this is, it's just, there's no substitute for it that way. It's just remarkable.